If we're in pain and we get surgery, we expect that to fix the problem, right? Well, sometimes it doesn't. Dr. Rudy Gari from Florida Pain Relief Group is here to help us figure out what to do next. Welcome back, Dr. Gari.
My pleasure.
How often do you have people come through your door and say, I've had back surgery?
Every day.
Every day. And
Every
some
single day.
people say they've had more than one.
I've had patients have 1, 2, 3. I've had one had 5 back operations.
And are they just at their wits' end because it's not helping?
Unfortunately, but we actually take a lot of pride in the fact that our specialty, pain management, it's the end of the road, but it's a nice road to be in because there's a lot of things that we can do for you. You know, there's a large majority of the back operations that do very, very well for patients, and the majority of patients do well from back surgery. But there is that select few that it doesn't do well. And so, for example, you know, the chances of a successful operation after the first back surgery, you know, it's somewhere over between 70 and 80+%.
Right, your odds are pretty good.
Very good. Second one, maybe 40, 50%, and the third one, you're dropping down to about 15 to 20%.
So more surgery is not an option at this point.
It's not an option because a lot of times, you know, by the time you've had 3 back operations, you really, you know, and the majority situations should be talking to a physician like myself that specializes in pain management, because at that point, unfortunately, your pain has pretty much become your illness. So we can find lots of ways to help you without another back operation.
What do you do when somebody comes to you and says, I've had 4 operations? Do you make sure you get an x-ray to see what's been done, or how do you assess the damage?
The first thing I do is to listen very carefully. So we're going to get a thorough history. I want to know everything that's happened. Why did you get the first back operation, second, third, etc. Second thing I'm going to do is examine that patient, find out exactly where the pain is and where it's coming from. 'Cause a lot of times you can pick up a lot on the examination. For example, I had a patient just a couple of days ago who came in and said he had pain in his elbow. And, you know, they told him maybe he had tennis elbow. Well, what he really had was a pinched nerve in his neck.
Oh, my.
Causing that. So you have to do an examination. And I picked it up because he had weakness, loss of sensation. There's a lot of things you can pick up in the examination. The third thing that I'm going to do is maybe an x-ray, maybe an MRI, maybe a CAT scan. You know, different studies. I want to know exactly what, you know, where you are after your operations. Once we've come across all that, we'll establish a diagnosis and establish a treatment plan, what to do. And over 90% does not involve another back operation.
Isn't that great? And what percentage involves pills? Is different ways to treat it?
Well, some patients are going to need pills.
Yeah.
And they could be an anti-inflammatory, it could be a muscle relaxant, it could be an opioid, it could be just an antidepressant,
Right.
just different things. But we want to minimize your pills. Nerve blocks, sometimes there are things that are called, for example, spinal cord stimulators. It's just very little tiny electrodes that we can place in your back to actually take away that pain sensation of your back and your legs and replace it with a much more gentle and much more comfortable sensation.
So basically you give them their freedom back.
That's what we try to do on every patient.
And so instead of going for the operation first and foremost, go see Dr. Gari first to see if you even need an operation in the first place.
Absolutely, and we will gladly refer you to a neurosurgeon or a surgeon if we need that, or if we want a second opinion.
Okay, Dr. Gari, thank you very much. You can visit their website, floridapainreliefgroup.com, to schedule your same-day appointment. Give them a call at 844-KICK-PAIN. We'll be right back with more Daytime, so don't go away.